Is that working okay now?
Yeah, fantastic.
I'm just going to share my screen. Okay. So can you see those slides okay?
Yeah, that looks great. Thank you.
Okay, brilliant. Well, thank you very much for that talk, Chris. I found that very interesting indeed, actually. My name is Alex. I'm a researcher at the University of Sheffield. And unlike the talk that Chris has just given there, the study I want to talk about today is in a much earlier phase. Realistically, we've got an idea that we'd like to test and to ask people what they think about it, really. So what we're trying to do with this particular piece of research is to adapt interventions that can improve sleep for people living with inflammatory bowel disease. And just a little bit of background before we sort of press on. Okay, so of course, it's not currently possible to cure IBD as such, so often the goal of treatment is to get control of the symptoms and to also try to improve a person's quality of life as well along the way. And we also know from areas outside of IBD that one good way to improve a person's quality of life is to improve the way people sleep. So in a recent study of around 8,000 people in the UK who were asked what some of the most important factors are to their well-being, the most commonly reported answer was that getting a good quality sleep was seen as one of the more important factors behind their well-being. And this was more than job security, more than income, more than relationship status. So we know that sleep is important to people in general. And I think with this in mind, there's a growing body of work suggesting that people living with IBD often report poor quality sleep. So this raises an interesting question to me, and that is, can we use interventions that improve sleep to also improve quality of life in people living with inflammatory bowel disease? Now, we think that improving sleep is a good thing in its own right and might also lead to better quality of life on its own. But there could also be additional benefits to improving sleep, but that are particularly useful in IBD. So, for example, some research suggests that quality of sleep in IBD might actually predict future symptom flare-ups. And we also know from areas outside of IBD that improving sleep can help people cope better with pain, can improve mental health, and can ultimately make life a little easier to deal with. So given that poor sleep is so common in IBD and that improving sleep could have these additional benefits, we would like to know why there is so little work into improving sleep in IBD. So are we missing an important treatment target that could contribute to those treatment goals that we talked about earlier of controlling symptoms and of improving quality of life? So what's the problem? Why is there so little work? And I think there are a lot of reasons, really, and I don't really have time to talk about all of them today. But I think some of the more common ones is we don't really understand what things lead to the poor sleep in IBD, and we don't really know how sleep can in turn impact on IBD symptoms and on quality of life. So I think we need more work to understand what the big drivers are of the poor sleep in IBD, and so we can use this to find ways to try and address these problems. And I think secondly, and this is the key point here, and this is the sort of the bulk of the work we're going to do going forwards, and that's we know that problems get into sleep and problems staying asleep through the night are some of the more common problems sleeping in IBD. So this is generally associated with insomnia. And of all the methods to improve these types of sleep problems, a psychological intervention called Cognitive Behavioural Therapy for Insomnia, otherwise known as CBTi, is the recommended first-line treatment, at least in the UK. However, CBT is not geared towards people with chronic health needs. So it's likely that we would need to tailor a CBTi intervention towards people with IBD so that people feel that they can engage with it in the first place and can ultimately get some benefit from it in terms of their sleep quality. And I think finally, no study has ever actually tested an intervention to improve sleep in people with IBD. So whether using a psychological intervention like CBTi is acceptable and whether it works or not is unclear. And if we can improve sleep in IBD using an intervention like CBTi, it's also unclear whether this would have knock-on benefits to other areas of life, like quality of life, like symptoms, and like mental health. So just getting to how we might want to address this problem. So we want to apply for funding to conduct a series of studies that might try and get us closer to understanding what the role of sleep in IBD is and whether having an intervention that we can use to improve sleep in IBD might also have these knock-on benefits to other areas of life. So as part of this research, what we first want to do is review existing work so that we can learn from what's already been done, work that's already been conducted into the role of sleep in IBD, particularly around what the causes of poor sleep in IBD are, but also to find out how researchers in the past have adapted interventions for sleep for those with chronic health needs, so that we could perhaps learn from them and not reinvent the wheel. But on top of this, we also want to run our own study where we will measure the different factors that might contribute to poor sleep in IBD, and also measure how this poor sleep might impact on areas of IBD like symptoms and quality of life and mental health. And we hope that by knowing these causes of poor sleep and how sleep in turn might impact IBD, that we might be able to think of solutions that we could use to help people get a better night's sleep. And this bit here is the perhaps the most important part of what we want to do. So we would like to work with members of the IBD community to ask how we need to adapt a standard off-the-shelf CBTi intervention so that it's more tailored to people with inflammatory bowel disease. So at the end of this process, we would hope to have a prototype intervention that's been developed with the needs of IBD at the centre of its design. And we'd like to test the intervention that we've developed to see if we can improve sleep in the first place, which would be, I think, important in itself, but also to test whether, when we can improve sleep, what this does to other areas of IBD life as well. And that brings me to the end of my, I've gone a minute over, but yeah, thank you for listening.
Okay, well, we'll launch your poll now.
Thank you. Okay. Yeah, so I have a couple of questions actually. So as I mentioned, this is early days really. This is just an idea, and we are sort of putting together the research proposal that we hope to submit early next year. But I think what I just wanted to get at the moment is the broad sort of research aim and idea clear or not so much. I think as well it'd be important just to understand whether you think that this is an idea that could be worthwhile. So this idea of trying to improve sleep in IBD and looking at whether that can have knock-on benefits to other areas of life. We'd like to know whether you find it helpful to have more support with sleep as part of your routine care. We've done some research in the past that suggests that might be the case, but I think it'd be useful today to try and understand that a little bit more. We'd also like to know whether we think if we could improve your sleep, do you think it would improve your quality of life, or perhaps do you think that it's not enough, that it could only have a minor effect? And then finally, do you think improving your sleep could impact your actual IBD symptoms as well? So these are all areas that are currently under research. There's some early work in there, so I'd be really keen to find out what you think. Shall I move on to a few questions while we're doing that?
Yeah, that sounds great. Can you see any? I haven't got rid of the ones from Chris's talk, but can you see any for you?
I can, yeah. I was going to scroll down and try and find where.
Oh yeah, they're at the bottom.
Yeah.
Okay, we've got 87 people who have voted. I'll leave it open for another 30 seconds and then we can...
Great, yeah. So we've got a question here. Will you look at how fatigue can impact sleep? So that's one of the key reasons why we'd like to do this work. So we know that fatigue is a really important problem in the community. We know that it's a research priority, for example, with the James Lind Alliance. And of course, we know there's work to say that sleep is one of the bigger predictors of fatigue. It's not the only predictor of fatigue. It's not the be all and end all sleep. There are other things involved, of course. But yeah, we think that by improving sleep, we could also improve fatigue, and fatigue would be one of our key outcomes that we would measure as part of the study. So we have another question here. So isn't the sleep in IBD closely tied with how your symptoms are at the moment? If you have an active condition, it will impact your sleep. And if in remission, your sleep would be better. Absolutely. So the sort of activity of the disease is really important in your sleep problems as well. We know that, but we also know that symptoms alone don't explain all of the problems sleeping in IBD. There are other things at play. And one of the big things I think that we've noticed at the moment that we want to look at a little bit more is how mental health plays a role in the problem sleep in IBD. So particularly anxiety and worry and rumination before sleep and through the night as well. So that's another area we're really keen to look at. But of course, yeah, disease activity and symptoms are very important as well. The question here. Presumably some people with IBD can't sleep because they have to go to the loo a lot during the night. Do you anticipate CBT can help with that? That's a fantastic question. And the reason why this is a fantastic question for my mind is when I first started thinking about how we could use psychological interventions for sleep, one of the first questions I thought I might get asked by somebody with IBD as well, it's a physical symptoms or I'm up through the night, how can a psychological intervention help with that? And what I actually think CBT could do here is, if this is your life for a long time, this becomes a constant thing where you're worried that you'll be up through the night, going to the bathroom, and that's going to be impacting your sleep. This creates a situation where the bedroom, the bed, and sleep becomes a little bit like a battleground, and you begin to associate the bedroom with this place where you don't sleep, and you have all these problems. And CBT might not be able to stop the symptoms through the night, but it could be something that could try and help to sort of control the feelings around going to bed, and sort of try and reassociate the bedroom with something as a place where you associate with sleep rather than wakefulness. But this is some of the areas we'd like to explore in the research itself, actually, to find out where we could use CBT to address problems like that. So a question here we have, how do you define quality of sleep? Is it the length of sleep or is there anything else you're looking at? It's another really good question, because traditionally in the IBD literature, when sleep's involved, people have looked at something called sleep quality. Now, sleep quality is generally referred to as problems getting to sleep in the first place, problems staying asleep through the night, but also feeling refreshed in the morning when you wake up as well. Now, that's really good. Sleep quality is a really good measure, but it's very general. So people with sleep apnea, people with nightmares, people with all sorts of very specific sleep problems would report poor sleep quality. But what we actually don't know at the moment is whether there are specific types of sleep disorder that are particularly prevalent in people with inflammatory bowel disease. So when we do our work, what we'd be looking at is specific symptoms, but also sleep quality as well. But it's not all related to how long you sleep. So sometimes it's more important to sleep 5 hours of good quality sleep than to sleep 8 hours of broken sleep. So question here, not sure finding purpose of the study valid. My issue is fatigue, but have no problem sleeping at night. I sleep okay. That's an absolutely perfectly valid thing to say, and we do recognise that this idea of improving sleep to improve fatigue and other areas of IBD is not for everybody. And part of the work we want to do is to understand who would benefit from this and who wouldn't. So that's one of the really important questions we have going forward. How would you know that the sleep issues relate to IBD and not other underlying health or mental conditions? I think from my view, the poor sleep that we see in IBD, for me, it's not so important what the key driver is. More that we want to provide an intervention that could help with it. So if it's more important that if it's a sort of a mental health difficulty that's driving it more than an IBD problem, then I think an intervention to improve sleep could be good regardless, really. So what is your patient selection inclusion criteria for the study? For example, are you including patients who have had JPAT surgery? Well, at the moment, this is early days, so there is no trial. So the bulk of the work for the next couple of years at least will be developing the intervention. It will be trying to understand the reasons behind the poor sleep and actually developing an intervention before we can trial it. So the trial is a few years off at the moment. So I'm not really too sure on the criteria we would have for entry at the moment. Just reading through these. Do some of the drugs for IBD affect sleep? Yes, in the short term. Some of the steroid medication has lots of effects on sleep, which is something we would need to incorporate into the intervention that we would want to develop, because, for example, an off-the-shelf CBT intervention wouldn't account for the use of medication that can directly interfere with sleep. So we would need to do something around medication and managing medication in the intervention itself. What do we have here? So there's lots of questions around sort of more medical things. My background is health psychology, so I'm not a medical doctor, so I will defer answering those because I do not know the answer, I'm afraid. Could data from people's fitness trackers, if they were willing to share that data, be useful to show patterns and see if there are any correlations between sleep patterns and symptoms? So this is another really interesting question. And one thing that the literature has not done in sleep and IBD is use things like fitness trackers or what we would call objective measures of sleep. It's tended to rely on asking people how they think they've slept. Now, I think that's a really important outcome, asking how people have slept. But what we traditionally find is there are huge discrepancies between how people think they sleep and how they actually sleep. And a really important question for me throughout this work is which one is the more important measure? Because if somebody objectively sleeps really well using a fitness tracker, but they report that they sleep poorly, which one's the more important one there? I would argue that it would be the self-report if people think they sleep poorly. And that's a problem. And this is one of the strengths of CBT, of Cognitive Behavioural Therapy for insomnia, is it works on changing those thought patterns and beliefs so that how people think they sleep can be more in line with how they actually sleep, which is an important thing in improving people's sleep quality. Do you think Fitbit data can provide useful feedback for IBD patients? Are you collecting sleep quality data? So I think Fitbit is useful. I think there are lots of problems with at-home monitoring of sleep. So generally they're not as accurate as the measures that we would have in a sleep lab, for example. But the benefit of things like Fitbit are that you can use them at home. So rather than coming into a lab and being hooked up to a machine in an unusual environment, which is obviously going to impact the way you sleep, you can do it at home in a more realistic, usual environment. So we can get a measure that's a little closer to what we would usually expect. But there are issues with the sort of validity and reliability of these tools. So we generally tend not to use them in research studies. So this is a good one here so I may have missed this, but when are you planning to start the study and how can people get involved? So we are planning to put a funding application in for this. So we've done lots of PPI work up until now, and we want to put the bid in towards the end of the year. And if successful, we will be looking to start this work next summer 2021. So I have quite bad sleeping issues since the first symptoms of my IBD. Is the proportion of bad sleepers significantly higher in IBD than in the general population? It's a really good question. And to be honest, the data is not particularly there. We did a study last year where we compared people with a diagnosis of inflammatory bowel disease to people without a diagnosis of inflammatory bowel disease. And we found that people with IBD generally reported much higher symptom severity of lots of different sleep disorders, insomnia, sleep apnea, so that's sleep disorder breathing through the night. But we also found more severe experiences of nightmares, of restless leg syndrome, of circadian rhythm problems as well. So not being trained to that sort of 24-hour rhythm. So yeah, and some of the early work we've done would suggest that there are much more severe problems sleeping in IBD. And why this is the case is unclear. Of course, symptoms are important, but we also think there are other things that drive this as well, like mental health, for example. So will you look at where you sleep? E.g., I can't fall asleep easily in my bed. I seem to sleep better on the settee sitting upright. Well, that's a really interesting question. And some of the questions about where you sleep do get covered in the CBT intervention, particularly around things like sleep hygiene. So what could be happening there, and what often happens, is that if you are having problems sleeping, the bedroom does become a place that you do not associate with sleep. So you could be really tired on the sofa watching TV, and then you go into the bedroom and then all of a sudden you're more awake than you were 5 minutes ago. So CBT tries to directly address this through lots of different ways, lots of different strategies, but generally trying to reassociate the bed and the bedroom with a place where you would sleep and feel comfortable sleeping as well. So we've just got, I think, 5 minutes left. So I'm going to go just run through the polls, and I'll try and answer any of these questions offline in a second. So is the research idea clear? So that's really encouraging for me that 90% of people felt that it was, but 10% of people felt it was not so sure. So I still think we've got some work to do there on making this a little clearer. And I do appreciate that. This is early days. So I'm hoping that by attending events like this, that we'll be able to get a little closer to something that's a little bit clearer for people as well. Do you think our research idea is a worthwhile area of study? Again, 90% felt that it was worthwhile. That is really encouraging as well, because that's the key kind of thing we're interested in at the moment is it worth doing this work? So we can go to a funder and we can say, people do think it's worthwhile, and that's really important. So that's really encouraging to see. Would you find it helpful to have more support with your sleep as part of your routine care? 77% said yes. I mean, that's kind of echoes a study we did a year ago where a lot of people felt that they wanted more support with their sleep during their routine care. 8% said no. That's really interesting as well. I'd really like to find out what some of the reasons are why people don't think sleep's particularly, why they would want more support in routine care as well. 15% not so sure. Do you think improving your sleep would improve your quality of life? Pretty resounding yes there with 90% of people. 1% not so sure, 9% not sure, and 1% no. Quite high numbers to think that people would think it would be useful in improving quality of life. And this is the one at the end here that I think is a little bit more divisive, and I can see that in the answers. Do you think improving your sleep could impact your IBD symptoms? 60% say yes, 39% not sure, 1% no. So this, again, it sort of mirrors some work we did a few years ago where we definitely found that some people felt that improving sleep would be useful to symptoms and some people just didn't. And that's an important thing to bear in mind here, because when you're offering interventions, I think, to people with IBD, saying that it might have these benefits to other areas, it's important to be mindful that that's not actually the opinion that a lot of people hold, and that's important for me to bear in mind as well. Okay. Have I got 3 minutes left? Is that correct?
Yeah, that's correct.
I'll run through a few other questions then while we have some time. So I feel I've developed health anxiety due to the constant full-on nature of IBD's impact on normal life, and it affects my sleep badly. I'm certain it affects my mental health. Would CBTi help? So there's a lot of work at the moment. So this idea of sleep being something that we can target to improve other areas other than just sleep is growing more and more and more. And one of the biggest applications of this is using CBTi interventions to improve sleep, but to also improve mental health. So this is by far the fastest growing field of sleep improvement. And we've actually just conducted a really big review that included almost 7,000 participants. And we generally found that when you can improve sleep using interventions like CBTi, that you see large impacts on mental health. So we're seeing mental health get much better. And interestingly, what we also found is we found that the more you can improve sleep, the more you can improve mental health. So we generally refer to this as a dose-response relationship. More sleep improvement equals better mental health. So this is one of the reasons why we really want to get this off the ground and apply this in IBD, because we think that it can be a useful tool in combination with other things to help with mental health as well. I think I've got time for one question. I've got a minute left. Will you be looking at a mix of ethnic minority groups within your sample? Absolutely. The goal with research is always to try and get as an inclusive a sample as possible, to try and get as many people involved. It's not always easy to do that, and it's a criticism of a lot of work that's gone before, that it is generally skewed towards specific types of people, and it's absolutely something we will be looking to do in the research going forwards. I think that's me. Thank you.
That's fantastic. Thank you so much, Alex. Really, really interesting stuff, especially the stuff about thinking about using wearable technology. It's really exciting area to think about. Okay, so we now have a bit of a break. So we're going to go away and get